Question 1. A patient is admitted to a hyperbaric chamber for treatment due to carbon monoxide poisoning. The treatment protocol specifies a 90-minute session at 2.5 otter. During the session, the patient begins to feel lightheaded and complains of chest pain. The technologist observes a slight increase in blood pressure and notices that the oxygen level is higher than usual. Based on the scenario, what is the most likely cause? Patient's symptoms and how should the technologist proceed? A. Oxygen toxicity due to excessive oxygen exposure. The technologist should reduce the pressure immediately. B. Barotrauma caused by improper pressure adjustments. The technologist should ensure that the chamber pressure is stabilized. C. The patient's symptoms are normal and can be attributed to the decompression process. The technologist should continue the treatment. D. Pulmonary oxygen toxicity due to prolonged exposure to high levels of oxygen. The technologist should terminate the session immediately. Answer: D. Pulmonary oxygen toxicity due to prolonged exposure to high levels of oxygen. The technologist should terminate the session immediately. Explanation: Oxygen toxicity, especially pulmonary oxygen toxicity, is a well-known risk when hyperbaric oxygen is administered at high pressure for extended periods. Symptoms like chest pain and lightheadedness, coupled with an elevated blood pressure, are classic signs of this condition. In this case, prescribed session duration of 90 minutes at 2.5 otter may have been too long or the oxygen exposure too high for this patient. Pulmonary oxygen toxicity can cause severe complications, such as damage to lung tissue. The correct response is to immediately terminate the session and notify the medical team for further evaluation and management. This underlines the importance of closely monitoring patients during treatment and adhering to established safety protocols, particularly in cases involving prolonged high-pressure exposure. Question 2. What is the primary purpose of performing a pre-treatment assessment for a patient undergoing hyperbaric oxygen therapy, HBOT? A. To confirm the patient's diagnosis and ensure the correct treatment protocol is followed. B. To assess the patient's ability to tolerate the pressure inside the chamber. C. To evaluate the patient's medical history and screen for contraindications or potential risks. D. To determine if the patient is psychologically ready for the therapy session. Answer: C. To evaluate the patient's medical history and screen for contraindications or potential risks. Explanation: Pre-treatment assessment is essential to ensure patient safety before undergoing HBOT. The assessment should thoroughly evaluate the patient's medical history to identify any contraindications, such as untreated pneumothorax, certain medications, or specific health conditions that may increase the risk of complications. Evaluation is critical to prevent adverse effects such as barotrauma, oxygen toxicity, or other risks related to HBOT. Although confirming the diagnosis and assessing psychological readiness may be necessary, the primary goal is to identify any contraindications and ensure that the treatment is safe for the patient. While tolerating pressure is important, this is typically assessed once the treatment has begun. Question 3. Scenario-based. Mr. Harris, a 55-year-old diabetic patient, is admitted for hyperbaric oxygen therapy, HBOT, to treat a chronic wound on his leg. The patient has been non-compliant with his diabetes medication and his blood sugar levels are elevated at the time of the assessment. The hyperbaric technologist has reviewed his medical history and noted that the wound has not been healing despite previous treatments. Should the technologist do in this situation before proceeding with the HBOT? A. Proceed with the HBOT session as planned since the wound requires treatment regardless of the patient's current health status. B. Inform the medical team about the patient's elevated blood sugar levels as it could affect wound healing and delay the HBOT until his diabetes is controlled. C. Increase the oxygen concentration to accelerate wound healing even though the patient's blood sugar levels are elevated. D. Perform the HBOT session. Reduce the pressure setting to minimize the risk of complications associated with diabetes. Answer: B. Inform the medical team about the patient's elevated blood sugar levels as it could affect wound healing and delay the HBOT until his diabetes is controlled. Explanation: Diabetes, particularly poorly controlled diabetes, can significantly impair wound healing due to its effects on blood circulation, immune function, and tissue repair processes. Elevated blood glucose levels could complicate the healing process and might increase the risk of infection or other complications during HBOT. It is essential for the technologist to inform the medical team of the patient's current condition so that they can address the blood sugar imbalance before proceeding with treatment. This ensures that the HBOT treatment will be effective in promoting healing rather than exacerbating any underlying issues. It is also crucial to ensure that the patient's diabetes is under control to maximize the benefits of HBOT. Proceeding with HBOT without addressing the underlying health condition could lead to ineffective treatment, while increasing oxygen concentration, C, or adjusting pressure, D, would not address the fundamental issue of uncontrolled diabetes. Question 4. Mr. Thompson, a 60-year-old male with a history of smoking and hypertension, is admitted to the hyperbaric chamber for treatment of acute carbon monoxide poisoning following a house fire. His blood pressure is elevated and he is exhibiting signs of confusion and dizziness. After the initial 30-minute treatment session at 2.0 otter, the patient's symptoms begin to improve, but the technologist notices an unusual rise in blood pressure and an increase in the patient's heart rate. The patient also reports mild shortness of breath. Based on this scenario, what would be the most appropriate course of action for the technologist to take considering the patient's cardiovascular condition and response to treatment? A. Increase the pressure setting to speed up the treatment process and relieve symptoms more quickly. B. Monitor the patient closely for the next few minutes, ensuring that oxygen levels remain stable, and alert the medical team to the changes in the patient's vitals. C. Reduce the treatment time to less than 60 minutes to prevent further cardiovascular stress, as longer sessions could aggravate the patient's condition. D. Continue with the treatment and reassure the patient as shortness of breath and mild dizziness are normal during HBOT. Answer. B. Monitor the patient closely for the next few minutes, ensuring that oxygen levels remain stable, and alert the medical team to the changes in the patient's vitals. Explanation. In patients with underlying cardiovascular conditions such as hypertension and a history of smoking, hyperbaric oxygen therapy can lead to increased stress on the heart and blood vessels. The rise in blood pressure and heart rate, combined with shortness of breath, indicative of a cardiovascular response to the elevated oxygen levels and pressure. The correct approach is to closely monitor the patient's vital signs and oxygen levels during the session and notify the medical team of any changes. A sudden rise in blood pressure and heart rate could be indicative of complications such as myocardial ischemia or a hypertensive crisis, which requires immediate medical intervention. Increasing the pressure, reducing the session time, C, without consulting the medical team could worsen the patient's condition. Continuing the session without addressing the rising vitals, D, would be unsafe and contrary to established best practices in HBOT. Question 5. Which of the following is the primary mechanism by which hyperbaric oxygen therapy HBOT enhances wound healing in patients with chronic, non-healing wounds such as diabetic ulcers or radiation burns? A. HBOT improves circulation by dilating blood vessels, increasing the availability of oxygen to the injured tissue. B. The high-pressure environment in the chamber stimulates the production of collagen, accelerating the healing process. C. Oxygen therapy increases white blood cell activity, promoting faster removal of infection and cellular debris. D. HBOT causes vasoconstriction that reduces the amount of blood flow to the wound, with swelling and pain. Answer. C. Oxygen therapy increases white blood cell activity, promoting faster removal of infection and cellular debris. Explanation. The primary mechanism by which HBOT promotes wound healing in chronic wounds is by enhancing oxygen delivery to tissues and stimulating various biological processes, including increased white blood cell activity. Hyperbaric oxygen boosts the function of white blood cells, especially neutrophils, by improving ability to fight infection and clear cellular debris from the wound site. Oxygen-rich environments also support angiogenesis, the formation of new blood vessels, which is critical for supplying the wound with nutrients and promoting tissue repair. While oxygen can improve circulation and stimulate collagen production, B. The most crucial effect of HBOT in wound healing is its ability to enhance immune response and tissue oxygenation. Vasoconstriction, D, is not typically a therapeutic effect. HBOT for wound healing, as it could impede blood flow rather than support it. Question 6. A 35-year-old female patient with a history of asthma is scheduled for hyperbaric oxygen therapy to treat a case of decompression sickness. During her pre-treatment assessment, the technologist notes that the patient has had mild asthma exacerbations in the past, but no recent attacks. Given the patient's history and the intended therapy, what should be the most important consideration in deciding whether to proceed with the treatment? A. Proceed with the treatment, as asthma is not contraindication for HBOT. B. Postpone the treatment until the patient's asthma symptoms are under complete control to prevent respiratory complications. C. Proceed with treatment, but ensure that the chamber pressure is lowered to avoid triggering an asthma attack. D. Have the patient use bronchodilator before entering the chamber to prevent possible asthma symptoms during the session. Answer: B. Postpone the treatment until the patient's asthma symptoms are under complete control to prevent respiratory complications. Explanation: asthma can complicate hyperbaric oxygen therapy due to the pressure changes and the high levels of oxygen, which may exacerbate breathing difficulties or trigger an asthma attack. The primary concern is ensuring that the patient is stable and well controlled before proceeding with HBOT, as even respiratory distress could be worsened by the treatment. While using a bronchodilator, D may provide temporary relief, it does not address the underlying risk of uncontrolled asthma during the high-pressure environment. Reducing the chamber pressure, C, may not provide adequate protection for the patient and could reduce the effectiveness of treatment, especially for decompression sickness. The safest course of action is to postpone the treatment until the asthma symptoms are under complete control, ensuring the patient's respiratory system can tolerate the therapy without risk of exacerbation. B. Question 7. Which of the following complications is most commonly associated with hyperbaric oxygen therapy, HBOT, and requires immediate intervention to prevent long-term damage? A. Decompression sickness, DCS. B. Oxygen toxicity leading to pulmonary damage. C. Infection due to contaminated equipment. D. Barotrauma to the lungs or middle ear. Answer: D. Barotrauma to the lungs or middle ear. Explanation: barotrauma is one of the most common complications encountered in hyperbaric oxygen therapy, particularly during the pressurization and depressurization phases of treatment. It occurs when the pressure inside the chamber causes a difference in pressure between the body's air spaces, e.g., the middle ear, sinuses or lungs, and the external environment. This can lead to injury such as eardrums or more severe conditions like lung overexpansion injuries. Immediate intervention is needed to manage barotrauma, including pain relief, pressure equalization techniques, and sometimes even decompression. While oxygen toxicity, B, and decompression sickness, A, are critical concerns, they typically develop after longer exposure periods or improper protocols, and both are generally managed through adjustments in pressure and oxygen levels. Infection, C, is a risk but can often be controlled with appropriate infection control protocols, making barotrauma the most pressing concern during HBOT. Question 8. Which of the following patient populations would most benefit from hyperbaric oxygen therapy, HBOT, for wound care treatment? A. A healthy individual with a recent surgical wound that is healing normally. B. A diabetic patient with a chronic, non-healing diabetic foot ulcer. C. A patient with an acute laceration and no underlying health conditions. D. A patient undergoing routine post-operative care following elective surgery. Answer: B. A diabetic patient with a chronic, non-healing diabetic foot ulcer. Explanation: diabetic patients with chronic, non-healing wounds, particularly diabetic foot ulcers, are among the most common candidates for hyperbaric oxygen therapy. HBOT improves wound healing by promoting oxygenation of hypoxic tissues, stimulating angiogenesis, and enhancing the immune response to infections. In diabetic patients, wound healing is often impaired due to poor circulation, nerve damage, and compromised immune function. While a healthy individual, A, or a patient with an acute laceration, C, may experience normal healing without HBOT. Chronic wounds in patients, diabetes, B, benefit greatly from the enhanced oxygenation provided by hyperbaric therapy. Post-operative patients, D, typically do not require HBOT unless they exhibit complications such as delayed healing or infection. Question 9. Which of the following is the most appropriate action to take if a patient undergoing hyperbaric oxygen therapy begins to experience symptoms of oxygen toxicity, such as visual disturbances or twitching? A. Increase the pressure in the chamber to expedite the delivery of oxygen. B. Continue with the treatment as oxygen toxicity is a rare and typically non-life-threatening condition. C. Immediately reduce the pressure and oxygen concentration and inform the medical team. D. Stop the treatment and provide the patient with a bronchodilator to alleviate symptoms. Answer: C. Immediately reduce the pressure and oxygen concentration and inform the medical team. Explanation: Oxygen toxicity can occur when the body is exposed to high levels of oxygen for extended periods, leading to symptoms such as visual disturbances, twitching, and in severe cases, seizures or damage to the lungs and central nervous system. The immediate response should be to reduce the pressure and oxygen concentration to prevent toxicity. Informing the medical team is crucial for further management and to adjust the treatment plan. Simply continuing the treatment B or increasing pressure A would worsen the toxicity, while the use of a bronchodilator D is inappropriate as the symptoms are related to oxygen exposure, not bronchospasm. Reducing the pressure and oxygen levels is essential for preventing serious long-term damage. Question 10. A 40-year-old male with a history of chronic asthma and smoking is undergoing hyperbaric oxygen therapy (HBOT) for treatment of severe carbon monoxide poisoning. During the treatment session, the patient begins to complain of shortness of breath, dizziness, and tightness in the chest. His oxygen saturation level remains normal, but his heart rate increases. What should the technologist do in response to these symptoms? A. Continue the treatment as scheduled, as these symptoms are normal during HBOT. B. Immediately stop the treatment. Reduce the pressure and inform the medical team of the patient's symptoms. C. Increase the chamber pressure to improve oxygen delivery and alleviate the symptoms. D. Administer a bronchodilator to the patient to relieve shortness of breath before continuing with the treatment. Answer. B. Immediately stop the treatment, reduce the pressure, and inform the medical team of the patient's symptoms. Explanation. The symptoms describe shortness of breath, dizziness, and chest tightness. Could be indicative of potential oxygen toxicity or cardiovascular response to the increased pressure and oxygen levels, especially in patients with history of asthma and smoking. In such case, immediate cessation of the treatment and reduction of the chamber is necessary to prevent further complications. It is also essential to inform the medical team for further evaluation and intervention. Increasing pressure C could exacerbate the patient's symptoms, and bronchodilators D may not be effective if the underlying issue is related to oxygen toxicity or other complications. Question 11. Which of the following is the most significant risk factor for developing oxygen toxicity during hyperbaric oxygen therapy (HBOT)? A. Prolonged exposure to high concentrations of oxygen. B. Underlying chronic lung disease. C. Being a patient with recent surgery. D. A history of decompression sickness (DCS). Answer A. Prolonged exposure to high concentrations of oxygen. Explanation. Oxygen toxicity is most commonly associated with prolonged exposure to high concentrations of oxygen at increased pressure. This condition occurs when tissues are exposed to excessive oxygen levels for extended periods, leading to damage, particularly to the central nervous system (CNS) and lungs. Prolonged exposure can lead to symptoms such as visual disturbance, twitching, seizures, and pulmonary damage, while underlying lung disease B and a history of decompression sickness (DCS-D) may complicate HBOT treatment. They are not the primary factors that lead to oxygen toxicity. Recent surgery C typically does not pose a direct risk for oxygen toxicity unless there are other complications. Question 12. A patient undergoing hyperbaric oxygen therapy for a chronic wound healing disorder begins to experience symptoms of barotrauma, including ear pain and a feeling of fullness in the ears. What should the technologist do to manage this situation? A. Increase the chamber pressure to relieve the symptoms and encourage ear equalization. B. Decrease the chamber pressure immediately and instruct the patient to perform a Valsalva maneuver. C. Continue the treatment without making any changes, as barotrauma is a normal occurrence during HBOT. D. Administer a sedative to help the patient relax and avoid further discomfort during the session. Answer. B. Decrease the chamber pressure immediately and instruct the patient to perform a Valsalva maneuver. Explanation. Barotrauma is caused by differences in pressure between the body's air spaces, e.g. the middle ear, and the surrounding environment. If the patient is experiencing ear pain and feeling of fullness, this is clear indication of barotrauma. The best course of action is to reduce the chamber pressure immediately and guide the patient through Valsalva maneuver, forcing A into the middle ear by pinching the nose and gently blowing, which helps to equalize the pressure. Continuing the treatment or increasing the pressure A would exacerbate the condition, and administering sedative D is unnecessary and could lead to further complications. Question 13. Which of the following best describes the mechanism by which hyperbaric oxygen therapy (HBOT) assists in the treatment of radiation-induced tissue damage? A. HBOT enhances the delivery of oxygen to hypoxic tissues, allowing them to heal and regenerate. B. The high-pressure environment in HBOT directly kills damaged cancer cells, reducing tumor size. C. HBOT increases the production of red blood cells, improving oxygen delivery to affected tissues. D. The oxygen therapy improves lymphatic drainage, reducing swelling and promoting tissue repair. Answer A. HBOT enhances the delivery of oxygen to hypoxic tissues, allowing them to heal and regenerate. Explanation: radiation therapy often causes damage to surrounding healthy tissues, particularly by inducing hypoxia, lack of oxygen, in affected areas. Hyperbaric oxygen therapy helps by increasing oxygen availability to these hypoxic tissues, thereby promoting healing and tissue regeneration. This process supports the blood vessels and enhances the function of fibroblasts, the cells responsible for producing collagen and extracellular matrix. While HBOT does not directly target cancer cells, B, or stimulate red blood cell production, C, it plays a key role in improving oxygenation, which is critical for healing. Lymphatic drainage, D, is not the primary mechanism of action for HBOT in treating radiation damage. Question 14. A 28-year-old male patient is undergoing hyperbaric oxygen therapy following a diving accident that resulted in decompression sickness (DCS). After the initial session, the patient reports feeling nauseous, lightheaded, and tired. What would be the best response to these symptoms? A. Continue with the planned treatment schedule, as these symptoms are common and usually resolve on their own. B. Reduce the pressure and shorten the treatment time to prevent further discomfort. C. Discontinue the treatment and refer the patient to the medical team for further evaluation. D. Increase the pressure during the next session to speed up the healing process and reduce symptoms. Answer: C. Discontinue the treatment and refer the patient to the medical team for further evaluation. Explanation: while mild symptoms such as nausea and lightheadedness may occur during HBOT, especially in patients undergoing treatment for decompression sickness, they should never be dismissed without further evaluation. Discontinuing the treatment and consulting the medical team ensures that the symptoms are properly managed and does not place the patient at risk for more severe complications. Increasing the pressure, D, or reducing the treatment time, B, could exacerbate symptoms, and continuing the therapy without addressing the underlying cause, A, is not recommended. Question 15. Which of the following is a potential complication associated with hyperbaric oxygen therapy (HBOT) that can affect the central nervous system? A. Oxygen toxicity, leading to seizures and visual disturbances. B. Decompression sickness, leading to joint pain and paralysis. C. Barotrauma, causing damage to the ear and sinuses. D. Hypoxia, leading to dizziness and shortness of breath. Answer A. Oxygen toxicity, leading to seizures and visual disturbances. Explanation: oxygen toxicity is a well-known complication of HBOT, especially when high concentrations of oxygen are used for extended periods. It can cause symptoms such as visual disturbances, seizures, and even central nervous system damage. The toxicity typically occurs when oxygen pressures exceed certain thresholds, resulting in excessive oxygen tissues, while decompression sickness, B. Barotrauma, C. and hypoxia, D. are also concerns in hyperbaric therapy. Oxygen toxicity specifically affects the central nervous system and is a significant complication that must be managed carefully. Question 16. A patient with a history of chronic obstructive pulmonary disease (COPD) is referred for hyperbaric oxygen therapy (HBOT) to treat a non-healing wound. What consideration is most important when determining whether HBOT is appropriate for this patient? A. The patient's oxygen saturation levels at rest and during physical activity. B. The presence of active smoking, as it significantly limits the benefits of HBOT. C. The severity of COPD and the patient's ability to tolerate pressure changes. D. The patient's response to past surgical treatments for wound care. Answer: C. The severity of COPD and the patient's ability to tolerate pressure changes. Explanation: patients with COPD have compromised respiratory function, which can make it more difficult for them to tolerate the increased pressure and oxygen concentrations used during HBOT. The severity of the patient's COPD is a crucial factor in determining whether they can safely undergo treatment. Even though oxygen saturation levels, A, and smoking history, B, play roles in wound healing, they do not directly affect the patient's ability to handle HBOT's pressure changes. The patient's response to prior surgical treatments, D, is secondary to the critical assessment of their respiratory function and ability to undergo HBOT without adverse effects. Question 17. Which of the following best describes the therapeutic benefits of hyperbaric oxygen therapy HBOT in the treatment of osteomyelitis, bone infection? A. HBOT increases the oxygen levels in the bone tissue, which enhances the function of osteoblasts and accelerates bone healing. B. HBOT directly kills the bacteria causing the infection, leading to complete eradication of osteomyelitis. C. The pressure in the chamber helps to remove the infected bone tissue by stimulating the immune system. The HBOT increases the blood flow to the bone, thereby promoting the absorption of antibody into the infected area. Answer: A. HBOT increases the oxygen levels in the bone tissue, which enhances the function of osteoblasts and accelerates bone healing. Explanation: HBOT promotes healing in osteomyelitis by increasing the amount of oxygen available to hypoxic tissues, including the bone. This oxygen facilitates the function of osteoblasts, bone-forming cells, improves the body's ability to fight infection, and supports tissue regeneration. HBOT can enhance the effectiveness of antibiotics. D. It does not directly kill bacteria. B. Or remove infected tissue. C. Instead, the primary benefit lies in improving oxygenation and supporting the body's natural healing processes. Question 18. A patient undergoing hyperbaric oxygen therapy for acute ischemic stroke begins to experience symptoms of confusion and agitation. What is the most appropriate action to take in this scenario? A. Stop the treatment immediately and provide the patient with a sedative to manage agitation. B. Decrease the chamber pressure and continue the session with close monitoring. C. Discontinue the session immediately, monitor the patient's vitals, and consult with the medical team. D. Increase the chamber pressure to accelerate the recovery process from the stroke. Answer: C. Discontinue the session immediately, monitor the patient's vitals, and consult with the medical team. Explanation: while HBOT can provide benefits for ischemic stroke recovery, confusion and agitation could be signs of oxygen toxicity, pressure-related issues, or other adverse effects. The immediate response should be to stop the session, monitor vital signs, and consult with the medical team for further assessment. Continuing the treatment or increasing the pressure D could worsen the symptoms, and administering sedatives A may not address the underlying cause of the symptoms. Question 19. Which of the following is a common contraindication for hyperbaric oxygen therapy? HBOT. A history of asthma without current symptoms. B. Pregnancy, especially in the second trimester. C. The presence of chronic ear infections. D. A history of myocardial infarction, heart attack without current symptoms. Answer: B. Pregnancy, especially in the second trimester. Explanation: pregnancy, especially in the second and third trimesters, is generally considered a contraindication for HBOT, as the high oxygen concentrations and pressure may pose risks to both the mother and fetus. Other factors, such as asthma A or chronic ear infections C, are not absolute contraindications but should be carefully managed. A history of myocardial infarction D typically does not contraindicate HBOT as long as the patient is stable and not exhibiting active symptoms of heart failure or acute myocardial ischemia. Question 20. A 45-year-old female with a history of chronic diabetes is undergoing HBOT for a severe diabetic foot ulcer. After several sessions, she develops a fever and increased pain at the ulcer site. What should the technologist's next step be? A. Continue the HBOT sessions as planned, as the symptoms are a common response to treatment. B. Discontinue HBOT, consult with the medical team, and assess the possibility of an underlying infection. C. Increase the pressure in the chamber to address the increased pain and fever. D. Administer an antibiotic to the patient before proceeding with further HBOT sessions. Answer: B. Discontinue HBOT, consult with the medical team, and assess the possibility of an underlying infection. Explanation: increased pain and fever could indicate the development of an infection which requires immediate attention. Discontinuing HBOT and consulting with the medical team is necessary to evaluate the patient's condition, conduct tests to rule out infection, and adjust the treatment plan. Continuing the therapy A could worsen the infection. Increasing the chamber pressure C would not be effective in addressing the underlying issue. Administering antibiotics D should only be done after confirming an infection and not as a routine measure without medical consultation. Question 21. A 60-year-old male with a history of myocardial infarction is referred for hyperbaric oxygen therapy HBOT to treat non-healing diabetic foot ulcers. During the initial treatment session, the patient experiences chest discomfort and shortness of breath. What is the most appropriate next step in managing this situation? A. Continue the treatment, as chest discomfort is common during HBOT. B. Stop the treatment, assess the patient's vital signs, and inform the medical team. C. Increase the pressure to relieve the discomfort and improve oxygen delivery to the heart. D. Administer nitroglycerin and continue the therapy to relieve chest discomfort. Answer: B. Stop the treatment, assess the patient's vital signs, and inform the medical team. Explanation: chest discomfort and shortness of breath in a patient with a history of myocardial infarction may indicate cardiac ischemia, which requires immediate evaluation. The best course of action is to stop the treatment, monitor the patient's vital signs, and consult with the medical team for further assessment. Continuing the therapy the pressure C could worsen the condition, while administering nitroglycerin D without assessing the cause could mask important symptoms. Immediate cessation and medical consultation are crucial. Question 22. A 25-year-old female patient is undergoing hyperbaric oxygen therapy for acute carbon monoxide poisoning. During the therapy session, she develops dizziness and tinnitus. What is the most likely cause of these symptoms? A. Oxygen toxicity due to prolonged exposure to high-pressure oxygen. B. Barotrauma due to pressure changes during the treatment. C. Hypoxia caused by insufficient oxygen delivery to the brain. D. A reaction to the chamber's environmental conditions, such as heat or humidity. Answer: B. Barotrauma due to pressure changes during the treatment. Explanation: barotrauma is the most likely cause of dizziness and tinnitus during hyperbaric oxygen therapy, particularly when pressure changes occur. The rapid pressure adjustments within the chamber can cause discomfort in air-filled spaces like the ears, leading to these symptoms. Oxygen toxicity is typically associated with prolonged exposure to very high oxygen concentrations, but would not usually cause dizziness or tinnitus early in treatment. Hypoxia C would not occur in a patient receiving HBOT unless there was a malfunction in the chamber. Environmental conditions D could also contribute, but are less likely to cause these specific symptoms. Question 23. A 55-year-old male patient with a history of smoking and chronic obstructive pulmonary disease (COPD) is undergoing hyperbaric oxygen therapy for an ischemic wound. He begins to complain of dizziness and chest tightness. What is the most appropriate course of action? A. Increase the chamber pressure to improve oxygen delivery and relieve symptoms. B. Reduce the pressure and monitor the patient for any changes in condition. C. Continue the treatment, as these symptoms are common in patients with COPD. D. Discontinue the treatment, assess the patient's vitals, and consult the medical team for further evaluation. Answer: D. Discontinue the treatment, assess the patient's vitals, and consult the medical team for further evaluation. Explanation: dizziness and chest tightness in patient with COPD could be signs of respiratory distress or inadequate oxygenation. These symptoms should not be ignored, and the most appropriate response is to stop the treatment, assess the patient's vitals, and consult with the medical team for further evaluation. Increasing the pressure A. Continuing treatment C. Could exacerbate the symptoms. Reducing the pressure B. May help, but further medical evaluation is needed to rule out any underlying issues. Question 24. A 70-year-old diabetic female patient with a non-healing wound is receiving hyperbaric oxygen therapy HBOT as part of her treatment plan. After several sessions, the wound begins to show signs of increased inflammation and erythema. What is the most likely cause of these symptoms? A. An allergic reaction to the materials used in the hyperbaric chamber. B. An underlying infection that is exacerbated by the increased oxygen concentration. C. A sign of oxygen toxicity affecting the skin and soft tissues. D. A normal response to increased blood flow and oxygenation at the wound site. Answer: B. An underlying infection that is exacerbated by the increased oxygen concentration. Explanation: increased oxygen concentrations can stimulate the growth of certain bacteria, particularly those that thrive in oxygen-rich environments, leading to an exacerbation of underlying infections. The wound's increased inflammation and erythema suggest that an infection may be present or worsening, necessitating an evaluation by the medical team. Oxygen toxicity C could lead to tissue damage. It is unlikely to cause localized inflammation and erythema in a wound, an allergic reaction, or a normal healing response. D are less likely explanations in this context. Question 25. A 40-year-old male who recently suffered a traumatic brain injury is referred for hyperbaric oxygen therapy, HBOT, to aid in his recovery. During the treatment, he begins to complain of severe headaches and nausea. What is the most likely cause of these symptoms? A. Oxygen toxicity affecting the central nervous system. B. Barotrauma due to pressure changes in the hyperbaric chamber. C. A side effect of the medications the patient is taking for pain management. D. A normal response to the increased oxygen levels during HBOT. Answer A. Oxygen toxicity affecting the central nervous system. Explanation. Oxygen toxicity, particularly affecting the central nervous system (CNS), a known risk during hyperbaric oxygen therapy when high levels of oxygen are used for extended periods. This can lead to symptoms such as headaches, nausea, visual disturbances, and seizures. Given the patient's history of traumatic brain injury, he may be more susceptible to C. Oxygen toxicity. Barotrauma B is more likely to cause ear pain or discomfort, and medications C may contribute to symptoms but are less likely to be the primary cause in this case. While some patients may experience mild discomfort, D severe symptoms like headaches and nausea warrant further evaluation. Question 26. A 45-year-old male patient undergoing hyperbaric oxygen therapy for severe radiation-induced tissue damage begins to exhibit signs of confusion and agitation. What should the technologist do in response to these symptoms? A. Immediately stop the treatment and reduce the pressure in the chamber. B. Continue the treatment as these symptoms are a normal response to HBOT. C. Administer a sedative and proceed with the therapy. D. Increase the chamber pressure to improve oxygen delivery and alleviate the symptoms. Answer A. Immediately stop the treatment and reduce the pressure in the chamber. Explanation. Symptoms of confusion and agitation during HBOT may indicate oxygen toxicity, particularly in patients with radiation-induced tissue damage who may be more sensitive to high oxygen concentrations. The most appropriate action is to immediately stop the treatment, reduce the chamber pressure, and consult with the medical team for further evaluation. Continuing treatment B or increasing the pressure D could exacerbate the symptoms, and administering a sedative C would not address the underlying cause. Question 27. A 30-year-old female with no significant medical history is referred for hyperbaric oxygen therapy following a diving accident resulting in decompression sickness (DCS). During the treatment session, the patient reports feeling lightheaded and faint. What is the most likely cause of these symptoms? A. Hypoxia due to insufficient oxygenation in the chamber. B. Oxygen toxicity caused by excessive exposure to high concentrations of oxygen. C. Barotrauma from pressure changes affecting the ears or sinuses. D. A vasovagal response to the pressure changes during treatment. Answer. D. A vasovagal response to the pressure changes during treatment. Explanation. A vasovagal response is the most likely cause of lightheadedness and fainting in a patient undergoing hyperbaric oxygen therapy, especially during the pressure changes. This response can occur when the body's autonomic nervous system reacts to the pressure shifts, causing a drop in heart rate and blood pressure, while oxygen toxicity B can cause neurological symptoms. It is more typically associated with prolonged exposure to high oxygen levels, not immediate symptoms like fainting. Barotrauma C would typically cause ear or sinus discomfort, and hypoxia A is unlikely in a patient receiving HBOT for DCS, as the therapy is designed to improve oxygenation. Question 28. A 50-year-old male patient undergoing hyperbaric oxygen therapy for chronic osteomyelitis is complaining of severe fatigue and a slight headache after each treatment. What should the technologist do next? A. Increase the chamber pressure during the next session to improve oxygen delivery. B. Discontinue the treatment and refer the patient to the medical team for further evaluation. C. Continue the treatment as planned, as fatigue and headache are common side effects of HBOT. D. Reduce the pressure in the chamber and monitor the patient's condition more closely. Answer. B. Discontinue the treatment and refer the patient to the medical team for further evaluation. Explanation. Severe fatigue and headache could be signs of oxygen toxicity, particularly in patients receiving hyperbaric oxygen therapy for prolonged periods. It is essential to discontinue the treatment and refer the patient to the medical team for further evaluation to rule out oxygen toxicity or other complications. Increasing the could worsen the symptoms, and continuing the therapy, C, without addressing the cause would not be appropriate. Reducing the pressure, D, may help, but a full evaluation is necessary to ensure the patient's safety. Question 29. A 60-year-old female patient with a history of smoking and chronic obstructive pulmonary disease, COPD, is undergoing hyperbaric oxygen therapy for a chronic wound. After several sessions, she develops a cough and slight shortness of breath. What is the most likely cause of these symptoms? A. Oxygen toxicity affecting the lungs and respiratory system. B. Barotrauma due to pressure changes in the hyperbaric chamber. C. An exacerbation of her underlying chronic obstructive pulmonary disease, COPD. D. A normal response to the increased oxygenation in the tissues. Answer: C. An exacerbation of her underlying chronic obstructive pulmonary disease, COPD. Explanation: in patients with COPD, the administration of high concentrations of oxygen can sometimes lead to an exacerbation of their respiratory symptoms. The increased oxygen levels might depress the respiratory drive, particularly in those with chronic co-retention, leading to symptoms such as cough and shortness of breath. Oxygen toxicity is less likely to be the cause unless the patient is exposed to very high levels of oxygen over a prolonged period, but that is uncommon in standard HBOT treatments. Barotrauma, B, typically causes ear pain or discomfort, not cough and shortness of breath, while the increased oxygenation, D, is typically beneficial. This patient's COPD may be making her more susceptible to respiratory complications. Question 30. A 75-year-old male patient with a history of uncontrolled hypertension and coronary artery disease, CAD, is receiving hyperbaric oxygen therapy for diabetic foot ulcers. After several sessions, the patient begins to show signs of dizziness and lightheadedness, especially when standing up. What is the most appropriate action? A. Continue the treatment and monitor for further symptoms. B. Discontinue the therapy and assess the patient's blood pressure and other vital signs. C. Increase the chamber pressure to improve circulation and oxygenation. D. Administer medication to stabilize the blood pressure and resume the treatment. Answer: B. Discontinue the therapy and assess the patient's blood pressure and other vital signs. Explanation: dizziness and lightheadedness upon standing may indicate orthostatic hypotension, which can be exacerbated by hyperbaric oxygen therapy, especially in patients with uncontrolled hypertension or cardiovascular disease. The most appropriate action is to stop the treatment and assess the patient's blood pressure and other vital signs to determine whether their underlying issue. Increasing the pressure, C, could worsen the symptoms, and administering medication, D, might mask the problem without addressing its underlying cause. Monitoring the patient's condition closely is critical in this situation.